are good to go, Mr. Chair. Whenever you wish to go.
You do? Yes, I do. I've lied. City of New Haven, Health and Human Services, Thursday, July 2016. The New Haven Board of Alders Health and Human Services Committee will be on Thursday, July 4th, 2022 at 6 p.m. Church Street, delivering on Act Legislative Matter 2022-0320. Order to the Borough Hall to authorize the New Haven Health Department to accept a grant award of $500,000 annually from the U.S. Office of the Assistant Secretary for Health and Office of Minority Health for the period of October 1st, 2022 through September 30th, 2025 to address factors contributing to structural racism in public health and to execute, acknowledge, implement, and deliver any and all documents as may be considered necessary or appropriate with respect thereto. This item is on file and available for public inspection in the Office of Legislative Services, 165 Church Street, per Honorable Dr. Junior Chair, Honorable Michael Smart, City Clerk. If you are in need of accessibility related accommodations, please contact 203-946-7651 voice or 203-946-8532 in accordance with the City of Haven Code requirements. All attendees can wear masks as that is changed as a mandate. Public basic comments to public testimony at CT.gov.
Brooke Logan, 96 Village Lane, Branford, Connecticut. Thank you for hearing us this evening. So the health department is looking for permission to apply for and accept a community-driven approaches to address factors contributing to structural racism in public health grant award from the U.S. Office of Secretary of Health and the Office of Minority Health. It is a 3-year grant with up to $500,000 available in funding annually. Through the grant, the health department will work to identify opportunities to dismantle structural racism that would reduce reported health disparities related to asthma in children under the age of 20 who live in New Haven. New Haven currently ranks 5th in the country on the list for the most challenging places to live with asthma, according to the Asthma and Allergy Foundation and their 2021 report. New Haven's child asthma prevalence rate is 14.3%, which is higher than the overall state average of 12.9%. The asthma prevalence disproportionately impacts children of color. After the first year of the grant, the project may expand beyond asthma to include topics such as lead poisoning, mental health, and obesity in children. So with the goal of improving pediatric health outcomes, the health department will convene a multi-sector team, which will include residents and caregivers for children with asthma, representatives from healthcare, legal, the Board of Education, housing, and environmental sectors. We've also asked the Board of Alders to sit on the team as well. The team will work collaboratively to identify local laws and ordinances and policies that may be creating racial disparities in asthma outcomes and compare policies to other jurisdictions. The team will then connect the policies to any relevant asthma outcome data. They will then disseminate findings to stakeholders and the community at large and create an action plan to modify changes in current laws, ordinances, or policies that contribute to childhood asthma. The project will evaluate the policies and practices across 5 domains of the social determinants of health. So we'll look at policies relating to housing, economic stability, the built environment, healthcare, and education at the organizational level, the local level, and regional level. And this will provide resources and a framework that will allow the health department to follow through on the recommendations made by the Board of Alders in its resolution declaring racism as a public health issue. Some of the policies the team plans to analyze includes extending the social safety net for stronger programs such as SNAP and WIC, looking at providing free public transportation, expanding school-based health center hours that go beyond the school calendar and school day, and adding mold, which is a known asthma trigger, to the residential licensing inspection checklist. So through the funding, we will be funding a full-time project coordinator to help lead and convene the report, the multi-sector team to create the programmatic and fiscal reports that are going to be required, as well as a community health worker to assist with these efforts. There will also be funding available to community members who participate on the multi-sector team as stipends to acknowledge their work. I'm happy to entertain any questions that you may have.
Just wanted to know a further breakdown on how the funds would be spent.
Yep. So the funds are primarily to support staff. It's not a project-based grant. It's really meant to review the policies and procedures. So I can provide you with a more detailed, like the exact budget that we'll be submitting tomorrow when the grant application is due. Right now, the draft proposal has a project coordinator. It has a community health worker, the travel and the salary and fringe that is associated with that. Funds allocated for local travel for the 2 individuals for attending meetings and conferences. There's funding for an evaluator. The grantors have requested an evaluation component to this, so there will be funding for that. Funding to assist with the legal analysis of the policies and what may be changed, if there's going to be any legal hurdles that need to be overcome. Data support, some advocacy and marketing, general office supplies for staff, stipends for residents who participate in the team. Stipends or food money will also be available to support this project and the team members, the larger community team members who participate.
Thank you, Mr. Chair. The fiscal impact summary says that 1/5 of the funding is for personnel. Is that just a consequence of how the form treats this? But it seems like you're saying the opposite is true. Like most of this is for personnel. Or are those contractors so they don't show up as personnel?
Yep, so there's a few things to it. So to ensure that we met the Board of Alders deadline, we didn't have a definitive breakdown of the budget. So this was our estimate at the time the paperwork was submitted. We are still working on finalizing the budget. The grant is due tomorrow. We're actively working on it. Aside from the project coordinator and community health worker, the remainder of the positions would be consultants.
Okay.
So they wouldn't be included in the salary and fringe on that paper. They would be listed in the, I forget what the title is, but the bottom category.
The other, yeah, probably, yeah, contract.
Mm-hmm.
When the grant is submitted, will we see the final, can you send us the final version? I guess it's getting submitted tomorrow.
Yep. So the grant is due, the application is due tomorrow at 6 p.m. So after that, probably early next week, we can submit to you the final proposal along with the budget if you would like to see that as well.
Yeah, absolutely, because right now we have 2 numbers and 1 paragraph, which is like, I get what you're saying. It's like, this is kind of a work in process. You're trying to get something out the door, but for us, we don't want to turn down free money, but we also understand that there's staffing constraints and the city can only do so much.
Understood.
Yeah.
Yep.
What was the other question? I feel like we have a lot of grants that come through that are evaluating things, and it seems like this falls into that category. It sounded like some of the potential outcomes wouldn't be focused on municipal policies, like you mentioned. Residential licensing, but the other outcomes were sort of things that would be aimed at the state. I'm trying to understand the thinking behind that, because like we go through this 3-year process. After those 3 years, we then send the report to our legislators. I guess what I'm saying is like, it seems like it would be valuable to focus policy recommendations on things that the city can control. I don't know, that's more of a thought than.
No, I appreciate that. The way that the notice for funding was written, they had asked that we focus on policies at both the local, regional, and state
Okay,
level.
so it's a consequence.
So we will prioritize local policies that we may have a larger opportunity to change. But as part of the grant work plan, we will be providing trainings to community members as well as to the core team on how to advocate for policy change. So that will be built in so that we aren't just providing a list at the end of the 3 years to say these are policies and submit those, but that we can actively encourage community members to advocate along with us for changes at the regional or state level.
And that can happen during the grant period.
It'll happen throughout the first year and on to the second and third year as
Okay,
well.
last one. Is there money in the budget for attorneys to draft policy changes? I feel like something I found frustrating within the city is like, we acknowledge there's a problem, but the city has such a limited amount of legal resources, and there's lawsuits, and there's all different things going on, and land dispositions and yada yada.
So we did put funding in for an attorney to assist with the legal analysis. We can, because we haven't submitted, we do have the opportunity to expand upon that, and it would be within the budget to allow for that as well. So we can put in a request for that.
I would think, especially if you have ordinances in mind, like put in some money for attorneys' hours to draft it. And that way it's like one step closer to something that can come back to the board and get approved. Thanks. Thank you, Mr. Chair.
Yeah, I feel very nice. I really strong feel, yeah. That's a really good point. I'm glad you keep mentioning that actually, because that's something we can actively solve. Why not? Always that.
I just have one question. Thank you. Our report also receiving the information finalized. So I understand the time. It's a little concerned. Also a little concerned. We're making like a decision around accepting money and we haven't seen the budget. But what I will encourage you is, since you laid out what you did, is that the portion for residents, like stipends for residents who participate, I encourage you all to really examine how much you can afford to maximize that, especially if you're looking to work with community organizations that might already be collecting data on the social determinants of IMO. And my board, there are organizations that are doing this to ensure that there's really full community participation in lines to the best of their ability. I think that it would really help with on the ground towards what seems to aim for some of these policy goals.
I would like to ask that if we can, I heard a request. What was that request?
Thank you, Mr. Chair. It was to receive the finalized information, and the request was to maximize the stipends for residents who participate. Okay.
So in terms of the first part, if we can get that before the next board of Alders meeting, preferably next Monday, considered Monday. We won't be taking action today. So there's no decision really being made. So just want to put that out there.
Thank you, Mr. Chair. Thank you for the presentation. Yeah, I just wanted to second my colleague here. I think it's very important that if stipends are being provided, that all efforts try to be made to ensure that stipends are as high as possible for especially some of our residents in our city who would have to take time out of their day to get involved in this. And I think other than that, I had one other thing that I forgot. But yeah, I think I just wanted to second that. Comment on my colleague. I think it's really important. I think it's true.
And also, I heard the request of just incorporating the legal attorneys into it. So we would like to see that reflected somewhere. You can highlight it. That would be helpful. context, just for the sake of the space we're in, the Board of Alders passed legislation on racism as a public health issue. I chaired and led the efforts with a task force, along with the health department, Yale Area Hospital, and other individuals who serve in health spaces to weigh in on racism as a public health issue. We were the first major city to pass such legislation. Much of this has been modeled by the state, who then a few months later passed the statewide version of it. A part of our recommendations to the health department was to continue to seek out things just like this. Well, this is like really great. So I do thank you all for coming at this emergent meeting, this emergent moment, because this is clearly a priority. And it's a part of our legislative agenda as a board. This very much is in alignment with exactly what we would like to continue to do in terms of following through the recommendations that was given and passed by the entire Board of Alders and recommended to the mayor's administration, who has since in turn done some initiatives to the cultural equity, the cultural affairs department, in creating infrastructure around the governmental impact around this issue. So this is clearly in alignment with the work that we did as on that. As just some background context. Alder Winter.
Thank you, Mr. Chair. The stipend, is it hourly? If it's hourly, what's the amount? If it's not, what's the amount? Do you know?
So again, the budget has not
Yeah,
been finalized.
sure.
It looks like it was, as of this afternoon, $50, if I'm reading it correctly, $50 per meeting with an annual amount of $700. So I will bring back the comments to the team because I think they were very helpful. Ed was clearly taking notes, so we can look at that.
One follow-up on that. I think that the reporting requirement for independent contractors is $600.
For
Just
the maximum.
just a thought, yeah, like if you're under 600, you don't have to get a 1099 and file. Anyway, just a thought.
Thank you. That's important.
One other thing for us collectively, but also for the chair, I think it's really important that we continue to follow up with this department and other departments about getting grant proposals before they're fully baked. Because I think like the dialogue here has been productive. And in the past, we sometimes get them like after, like, you know, when they're like all need to be received practically. So I think this is really helpful. I appreciate the effort that you all are making in getting this to us before it's out the door. I appreciate the chair's efforts to ensure that. Thank you. Thank you.
Just for the record on that last part, in this moment, oftentimes the federal grants come at a later notice than usual. So in this moment, this is like clear action as the chairperson called this emergency meeting out of our regular time to ensure that happened. Yeah. So there have been times where opportunities have come through departments with even less time sometimes, and mostly just because that's just kind of the nature of how grants are sometimes. I have issued citations to previous health directors concerning this very issue. So it is on the record. I've been accused of potentially blocking, which was not the case. And I was just ensuring that the process was adhered to. So hopefully we can continue that process. And I should say, since then, health department has been doing that. And also, most of the grants that we received in this last year has been a lot of continued grants that we've already heard. Therefore,
Uh-huh.
You know, it's really routine. So I just want that for the record that they actually done a great job of compliance, citation, all their actual aspect.
Thank you, Mr. Chair. So I guess my question slash request is, as you all are building on this proposal and then even post and begin to figure out and implement, I'd really be interested in seeing the breakdown of throughout New Haven, how we will be able to identify within the various neighborhoods, how you're gonna allocate resources and time. And I bring that up because I'm a new home myself, and statistics show that in the city of New Haven, our children have the highest rates of asthma. So this is particularly, I'm particularly passionate about this and making sure that time and resources are planned within data collection, et cetera, within areas of need that's proportionate to the level of need. So I hope that was clear enough. But yeah, I'd like to be involved and also to learn about where you guys go and moving along with building this out.
Sure, that is my comments. We are at the pleasure of your communications, so they can come back and will likely come back. And as many communications and workshops that you like, they don't have a choice. So, and also we have a seat on the, what are we calling it this time?
Just the multi-sector team for now, you do have a seat.
So there will be a moment for a representative to be on that. All the rules are.
Thank you, Mr. Chairman. Just one similar to that. I think it should be given that let us know whenever you need folks to help recruit for participants in stipends. It's really helpful whenever we get that information as soon as possible. We can get that out to folks as soon as possible, and folks from the city side and our side aren't rushing to recruit people. I think that's a common issue sometimes with similar efforts like these, rushing at the very last minute to recruit people. So whenever that information comes through, just ask that be something.
Actually, you just prompted another thought. What is the flexibility on changes, and how far can we deviate if we feel as a board, once we review the budget before the next time we vote, can we?
So can you define changes? And there's.
I'm hearing concerns. If alders don't feel as if it's clearly stated in your submitted proposal before the next meeting, if there are suggestions, can that be done?
The proposal would not be able to be amended. The budget typically can be amended after the fact. So typically with federal grants, they provide, what you submit is your proposal. They will give you an opportunity to amend your work plan before you start. So if there are items in the work plan that you would like addressed, there is likely going to be the opportunity, I cannot guarantee, but there will likely be the opportunity to do that. In regards to the budget or the stipend, there's always a budget revision process for any grant that we can go through and request to the funder that they accept it so that we can change the dollars around.
Just, do we feel good about that and understand that? Okay, I just, I feel like a lot is happening very quickly. And I just wanted to reassure folks that it sounds like the most important piece is that budget.
Mm-hmm.
And it can be potentially, usually
Shifted.
revised.
Mm-hmm.
So, okay.
Thank you, Mr. Chair. Is there any discussion in the proposal about how this overlaps with the city's efforts around climate mitigation and building electrification, vehicle electrification. I think that's all tied up both in terms of indoor air quality and outdoor air quality. And we have municipal goals to try to electrify the city's buildings and vehicles by 2030. And I feel like there's just a lot of overlap here. So I wanted to encourage that if it's not in there.
There are aspects regarding some climate and some energy efficiency written into the proposal currently, but I will also bring this back to the team to see if we can incorporate it in the final proposal before it gets submitted.
Okay, thanks. Thank you, Mr. Chair.
Very good question. Anyone else? Okay, so here's the deal. If there are any follow-up questions, we'll filter them to you now to ensure that they can get sent to the health department before our school board of alders meeting. But we're gonna do that in one shot together. So please, just direct it to Al, not yourself. Okay? Thank you.
Thank you.
Thank you.
Are there any individuals wishing to testify on this item? Are there really any individuals willing to testify on this item? Seeing none, will now entertain a motion to close the public portion of this meeting.
So moved.
Hearing it moved in second, all in favor say aye. Aye. Opposed, abstention. The public portion of this meeting has been closed. We'll entertain general discussion, but we will not be taking action on any of the matters on tonight. Alder Absalom Smith.
Thanks, Mr. Chair. I'm encouraged by the fact that the department is applying for this grant. I want to see this because I think as long as those things that we requested are sent to us and then we have some ability to work together if it's necessary to see some revisions to the budget, I think that's fine. Big concern for me is always just like the equitable focus of funding research on areas that demonstrate this is needed and children are affected by asthma. I don't know if you'll have time for me to say now, but I'd be very interested in serving on the organization.
Mr. Chair, I just wanted to echo the context that you gave everyone earlier. I think this is as a direct result of the efforts by this committee and by the board of alders initially declaring racism crisis here in New Haven. This, I believe, is the right effort. This grant application work plan is in as a direct result of that. I just wanted to highlight that and just really highlight that because I think that's important. Thank you to the health department as well for the efforts in following that with action. Thank you, Mr. Chair.
Alder Winter.
Thank you, Mr. Chair. I think we're making progress on the process here in terms of getting a proposal that's not completely set in stone and being able to weigh in on it. I do think we're entitled to and should receive a draft, of something like this in the future, with the understanding that it is a draft and things may change. But I think it would provide a more meaningful opportunity for us to give feedback or constructive criticism. Thank you, Mr. Chair.
To that, our regular scheduled meeting is the fourth Thursday of the month, so there's technically still to call another meeting if you like.
But they're submitting tomorrow, right?
With the caveat that we can do revisions to the most important part, which is the budget. So, and that's the basis of most of the questions that I have. Okay. The chair will entertain a motion to adjourn. So
Second.
hearing it moved in second, all in favor say aye.
Aye.
Any opposed? Any abstentions? Have a wonderful time.
Thank you.
Thanks, guys, for coming. I really.
Oh, yeah, no, this was worth Where's the trip downtown?
Walk with me.
So